The fluorescent lights hummed overhead like a fluorescent hum, casting everything in that particular hospital white that made even the living look pale. Dr. Sterling had just finished his morning rounds at Sacred Heart, moving through the corridors with the authority of a man who'd never questioned his own place in the hierarchy, never considered that someone below him might see something he didn't. The night shift nurse had been working at Sacred Heart for 4 years without incident, invisible in the way that good night shift nurses become invisible, competent enough that no one noticed, quiet enough that no one asked her name. But in exactly 48 hours, everything would change. In exactly 72 hours, a general would kneel before her in the hospital chapel. And in exactly 18 minutes, the patient who would trigger all of it would arrive through the emergency bay doors. The smell of antiseptic hung thick in the pre-dawn air as Natalie Hayes checked the monitors in Intensive Care Unit 3, her hands moving with the efficiency of someone who'd done this motion 10,000 times. Her scrubs, faded blue, 2 sizes too large, worn at the cuff, were already stained with the residue of a 12-hour shift. She moved between beds without sound, her shoes whispering against the tile floor, checking drip rates and ventilator settings with the kind of focused attention that had kept 18 patients alive through the night. None of them knew her name. The families who sat in the waiting room, the residents who called for her assistance, the attending physicians who consulted her observations, none of them thought to ask. She was the night shift. She was just there. And that was fine. That had always been fine. But her hands told a different story. The scars running across her knuckles, pale and thin like old fishing line, spoke of trauma and sutures and years that had nothing to do with hospital work. The calluses on her palms were too pronounced for someone who'd only ever held a stethoscope and a chart. And if anyone had looked closely, which they never did, they would have noticed the way her shoulders held a particular kind of tension, the way her eyes tracked exits and entry points, the way she never, ever stood with her back fully to the door. Muscle memory dies hard. She was checking the ventilator settings on the patient in Bay 7 when her phone buzzed against her thigh. A text from her son Marcus Jr., 16 years old and angry in the way that teenagers became angry at mothers who kept secrets. Mom, where were you? You missed dinner again. She didn't respond. She'd miss many more dinners before this was over. What she did do was reach into the inside pocket of her jacket, the one hanging in her locker downstairs, and touch the faded unit patch sewn into the lining. The Eagles. SEAL Team 3. 2 decades old and wrapped in paracord that she'd tied herself the night before she was ordered to disappear from existence. The emergency intercom crackled at 5:13 a.m., incoming trauma, Delta Force personnel injured in theater, ETA 12 minutes. Natalie's hand stilled on the ventilator dial. Delta Force. Tickrit. Combat injuries. The medical team would mobilize. Dr. Sterling would come down from his office to oversee the case personally. Officers always brought the politics of rank into the hospital, and Sterling collected rank like some people collected titles. She returned to her charting and waited, her jaw tight in a way that only someone watching very closely would notice. The patient arrived exactly as predicted, brought into Trauma Bay 1 by 2 soldiers in desert camouflage whose boots left wet prints across the tile. General Marcus Wade, age 52, shrapnel and blast injury sustained in an IED detonation in Tikrit 3 weeks prior, healing well but experiencing breakthrough pain episodes that the initial surgical team hadn't adequately addressed. He was conscious, alert, and in the presence of 2 adult children who'd flown in from Atlanta to monitor his care. Natalie observed from her position at the nurse's station, noting the way Wade's right hand trembled when he thought no one was looking, the way he breathed shallow, the way the pupils of his left eye didn't respond quite as quickly as his right, possible orbital fracture, definitely inadequate pain management, the kind of thing that was easy to miss if you were too focused on the prestige of the case. Dr. Sterling arrived 17 minutes later, moving through the trauma bay with the particular confidence of a man who'd built his entire career on the principle that hierarchy was not a suggestion but a law of nature. He was 58, with grey at the temples that he cultivated carefully, with a voice that had authority engineered into it, with the kind of jawline that had never questioned itself. His presence made the air pressure change, the way the room actually seemed to shift when he entered. 2 residents immediately stepped back. The trauma surgeon yielded to his authority without a word. And when Sterling ordered a morphine infusion at a level that made Natalie's hands pause over her keyboard, no one questioned him. No one except her. "Dr. Sterling," she said, not loud, just present. She had learned long ago that volume was not the same as authority. The patient's pain presentation doesn't match his physical exam. Those are stage 3 injuries, maybe stage 3.5. That dosage will suppress his respiratory drive. The room went still. Not the way that rooms go quiet for good news, the kind of quiet that comes when someone has violated an unspoken agreement about how the world should work. Dr. Sterling turned to face her, and his eyes moved down her body as if measuring something he found lacking. "Excuse me." "The sedation order," she continued, her voice level, her hand steady. "Request we start lower. 5 milligrams. Titrate to response." He's held his pain response through Tikrit. He can hold it through recovery. Sterling's smile arrived before his words did, and it had the quality of something sharp wrapped in courtesy. "Thank you for your input, Nurse Hayes." He knew her name. That was worse than if he hadn't. "But I've been managing post-trauma cases longer than you've been a nurse. General Wade will receive the prescribed dosage. Your job is to administer it, not question it." He turned back to his patient. He'd already forgotten her. But Marcus Wade had not. The general's eyes had tracked her face as she spoke, and there was something in his expression, a recognition, maybe, or a memory stirring at the edge of consciousness. He studied her with the particular intensity of a soldier, the way soldiers study everyone, and for exactly 3 seconds, something flickered across his features. Then the morphine hit, and the moment passed. 22 minutes later, Natalie was reviewing the medications with Sterling's team when he called her into his office, a corner space on the 2nd floor with large windows overlooking the parking lot and the kind of mahogany desk that announced its own importance. His words came quickly, efficiently delivered, designed to be devastating without seeming personal. She'd overstepped protocol. She'd questioned his clinical judgment in front of the patient and his family. She'd demonstrated a fundamental misunderstanding of hierarchy in a medical setting. And because Sacred Heart took these matters seriously, Sterling had already taken the liberty of documenting the incident with a formal write-up. She would find a summary of his concerns posted on the unit board within the hour. "This is noted as insubordination," he said, pushing a folder across the desk. "Your next step would be termination." She didn't flinch. She didn't pull her eyes away. She didn't let the silence stretch long enough to seem like weakness. She just absorbed the words like they were weather, unchangeable and inevitable, and when she spoke, it was in the kind of voice that had once commanded 20 soldiers across a mountain pass in Helmand province. "With respect, Dr. Sterling, General Wade was 6 years old when I pulled him out of a burning Humvee in Tikrit. I think I know how to manage his pain." The words hung in the air between them, impossible and ridiculous and absolutely true. Sterling's expression moved through several speeds, confusion, dismissal, and finally, the cold certainty of a man who decided she was lying and that her lie was both pathetic and insubordinate in roughly equal measure. He picked up his pen and began drafting her termination file before she'd even left his office, the kind of swift institutional violence that required only paperwork. She walked out into the hallway where the fluorescent lights buzzed like they always did, and she did not allow herself to feel anything at all. The break room fell silent when Natalie walked in at 6:53 a.m. 3 nurses, Rodriguez, Chen, and Marcus, sat clustered around a laminate table with cooling coffee. The moment her shoes crossed the threshold, they moved. Not frantically. Synchronized. Rodriguez grabbed her cup. Chen stood and buttoned her cardigan. Marcus left his phone on the table and walked out without looking back. The exodus took 8 seconds. The door closed with a pneumatic hiss behind them. Natalie stood alone in a room that smelled like burnt coffee grounds and institutional bleach, the kind of smell that never quite leaves hospital walls no matter how many times you mop. She poured water into a ceramic mug that had been hers since 2004, chipped on one side, the hospital logo faded to almost nothing. Her hands were steady. She did not check her reflection in the window. She did not allow herself to feel the weight of the write-up Sterling had posted on the unit board before the morning shift even clocked in. Insubordination. Inappropriate clinical judgment. A physician's order had been questioned. That was the crime. That was enough. The hallway outside the break room was empty except for the hum of the fluorescent panels overhead and the distant rhythm of beeping monitors from the ICU wing. Natalie knew where Sterling would be at this hour, dictating notes in the physician's office on the 3rd floor. She took the stairs instead of the elevator. Her legs carried her up the concrete steps with the kind of mechanical precision that came from 100,000 similar walks over 2 decades. One foot. The other. Each impact soft. Controlled. Sterling's office door was open. He sat behind a mahogany desk that probably cost more than 6 months of her salary, his reading glasses sliding down an aquiline nose. A fountain pen hung from his right hand. On his desk lay a personnel file with her name printed on the tab. He was writing something. Probably the final draft. The memo that would make the write-up official. The beginning of the end. He looked up before she could knock. His expression shifted, surprise, then something colder. Contempt. The kind reserved for people who did not understand the natural order of things. Ms. Hayes. My door was open for administrative staff, not floor nurses. She stepped inside and closed the door behind her. I pulled him out. Sterling set down his pen with deliberate slowness. Pulled who out of what? General Wade. Tikrit. 6 years ago. Burning Humvee, Charlie Company checkpoint. Her voice did not waver. She was not asking permission to speak. He was 6 years old. Dependent in the green zone. I went back in when the ammunition started cooking off. I pulled him out. Sterling leaned back in his chair. It creaked. His eyes narrowed, not with recognition but with something worse, dismissal. The kind of look a man gives when he hears something that cannot possibly be true. You're claiming you knew General Wade before his admission. Not claiming. Stating. And you believe this gives you standing to question my treatment decisions. He picked up the pen again. The gesture was meant to dismiss her. It did. This is precisely the kind of fantasy that concerns me about your performance, Ms. Hayes. A soldier had a nightmare. You imagined a deeper connection. Now you've constructed an entire mythology to justify your insubordination. He began writing again, his handwriting precise and unhurried. I'm making a note of this conversation. It will be included in your termination file. She let that land. 30 seconds of silence. Then one tear escaped from her right eye. She did not blink. Did not look away. Did not wipe it until it had traced half the distance down her cheek. Then she reached up and brushed it away with 2 fingers, maintaining eye contact the entire time. You have no idea who you're standing next to. The words came out the way she meant them, not angry. Not defensive. Just a statement of fact delivered with the kind of absolute certainty that made Sterling's pen pause for exactly 2 seconds before resuming. His jaw tightened. He did not like uncertainty. He did not like people who did not crumble when he predicted their destruction. Get out of my office, Ms. Hayes. She turned and left. The door closed behind her. She walked down the hallway at the same steady pace she had climbed the stairs. Behind her, through the office window, she could see Sterling watching her go. His hand was moving across the file again, writing faster now. The termination was accelerating. The institutional machinery was grinding into motion. The morning shift began an hour later. Natalie clocked in at 7:13 a.m. The unit board displayed Sterling's write-up in the space reserved for staff notifications. It was printed on hospital letterhead. Her name was in paragraph 2. By 7:51 a.m., every nurse on the floor had read it. By 8:15 a.m., the pattern had become clear. No one made eye contact. No one greeted her at the supply station. No one asked her to cover breaks. The ward operated around her like she was a piece of furniture that could be worked around but not acknowledged. During a blood draw on the 4th floor, Jen walked past without stopping. During medication rounds on the 2nd floor, a resident, young, probably 2 years out of medical school, asked Rodriguez to verify a dose instead of asking Natalie, even though Natalie had been standing 3 feet away. At 11:22 a.m., Rodriguez and Marcus sat together at lunch and left when Natalie entered the break room for water. The message was not subtle. Sterling's write-up had been the formal declaration. The silence from her colleagues was the execution. By noon, Natalie had not spoken more than necessary to anyone. She moved through the hospital with the kind of invisibility that comes from being so thoroughly cast out that the institution itself begins to pretend you do not exist. The irony was sharp enough to cut. She had spent 2 decades learning how to disappear into shadows. Now the place she had called home was making her disappear. But that was not the worst part. The worst part came at 2:38 a.m., during the night shift, when the ER phones began ringing with a rhythm that meant incoming trauma. The dispatch radio crackled with voices from paramedics already en route. 2 soldiers. IED blast zone. Multiple lacerations. Orthopedic fractures. 1 with possible abdominal penetrating trauma. ETA for minutes. The ER transformed in seconds from the hum of routine night work to controlled chaos. Nurses moved. Doctors prepared bays. Equipment was staged. Blood was ordered from the bank. Natalie had already moved to help when Sterling arrived in the ER, his movement authoritative, his presence dominating the space the way it always did. A resident handed him a trauma summary. Sterling skimmed it and began barking orders. Wrong orders. The penetrating trauma needed ultrasound first. Chest assessment before abdominal intervention. But Sterling had already committed to a course. By the time the paramedics wheeled the first soldier through the doors, the ER team had been directed toward a working hypothesis that did not match the injury pattern. The second soldier came through 70 seconds later. This one was worse. The pressure in the room changed. The machine seemed to buzz louder. Natalie stood at the far end of the bay, watching the monitors, watching Sterling's hands, watching the vital signs cascade in the wrong direction. The systolic pressure was dropping. O2 sat was falling. The patient's chest was filling with air, not blood. Tension pneumothorax. Classic presentation. Textbook physiology. But Sterling was focused on the abdomen, calling for ultrasound, calling for more for access, missing what was actually happening because the institutional hierarchy of the ER was locked in behind his authority. No one would contradict him. No one would suggest the obvious. Muscle memory took over. Natalie moved. Not with the careful calculation of a night shift nurse following protocol. She moved like someone whose body knew exactly what needed to happen because it had done it before in conditions infinitely worse than a hospital bay with fluorescent lights and antiseptic. The flatline beep cut through the noise like a scalpel. Her hands reached the crash cart. 14-gauge needle. 14-gauge catheter. Second intercostal space. Midclavicular line. The physiology was simple. The execution was precision. She did not ask permission. She did not wait for a doctor's order. The needle punctured the pleura. The hiss of air escaping sounded like a creature releasing pressure that had been building for years. The O2 sat began climbing. 75. 82. 88. Stable. The blood pressure rose. The rhythm returned. The room went dead silent. Sterling stood on the opposite side of the patient. His hands were frozen at his sides. His face had gone the color of old hospital tile. He was watching her. Everyone was watching her. Watching her hands move with the kind of automatic precision that belonged to someone who had done this in field conditions with nothing but a knife, a prayer, and a soldier bleeding out in sand instead of sheets. Natalie stepped back. The patient was breathing now. The crisis was contained. She set the used needle in the sharps container and walked toward the hallway. No one stopped her. No one spoke. The silence held long enough for the only sound to be the steady beep of the monitor, the whoosh of the ventilator, the whisper of fluid running through 4 lines. She had no idea what was about to walk through those doors. The monitor's sustained beep filled the quiet morning as Dr. Sterling finished his rounds on the cardiac ward at Sacred Heart. General Marcus Wade lay in bed 412, his chest rising and falling beneath white hospital linen, his color better than it had been 3 days prior. The sedation Sterling had ordered was working exactly as prescribed. Everything was textbook. Everything was controlled. Everything was wrong, though Sterling would never know it until the moment his own ignorance tried to kill a man. At 6:08 a.m., Wade's oxygen saturation began its invisible collapse. The first indicator was a subtle compression in his breathing pattern, shallow, rapid, desperate, like a swimmer who'd forgotten how to surface. His right lung was filling with a trap between the visceral and parietal pleura, pressure building with each breath he took. Tension pneumothorax. A mechanical catastrophe that would kill him in minutes if left untreated. Sterling was reviewing discharge paperwork at the nursing station when the monitor's alarm shifted from steady beep to panicked chirp. Nurses scattered toward bed 412. He followed, moving with the unhurried confidence of a man who'd never truly failed. Natalie saw it before she heard it, the way Wade's neck veins distended like cords ready to snap, the way his oxygen saturation numbers climbed down the monitor instead of up. 68. 63. His breathing had become desperate heaves, his body fighting physics. She was 3 rooms away, restocking a crash cart, and she moved before conscious thought could question the command her muscles had already received. Sterling arrived at the bedside first, but arrival and action were not the same thing. He stared at the monitor. He checked the ventilator tubing. He ordered a chest X-ray as if an X-ray would matter when the patient had 4 minutes left at best. His voice carried authority but no urgency. No clarity. No recognition that this was not a problem that required documentation, it was a problem that required a needle. "Get me a portable chest film," Sterling said, his tone suggesting he had unlimited time. Natalie pushed through the gathering crowd, her voice dropping an octave in a way that made 3 nurses turn as if they'd heard a command they hadn't consciously registered. "We don't have time for imaging, doctor. Tension pneumothorax. He needs decompression now." Sterling's eyes narrowed with the particular contempt a man reserves for insubordination in front of an audience. "The diagnosis is premature. We need." 51, Natalie said, her voice flat as a briefing room. She wasn't speaking to Sterling anymore. She was speaking through him. Distended neck veins. Tracheal deviation. Decreased breath sounds on the right. "Sir, with respect, he's in decompensation." The room had gone still in a way that made the overhead fluorescent lights sound suddenly loud, a buzz like insects trapped in glass. No one moved. No one breathed. Sterling opened his mouth to reassert hierarchy, to defend the fortress of his credentials, but Natalie had already turned toward the crash cart. She'd moved like that once before, 20 years back, in the burning wreckage of a Humvee outside Tikrit. The world had been chaos then, fire, screaming, the smell of diesel and copper and melting rubber. A 6-year-old boy trapped in the back seat while his father, a newly promoted colonel, lay unconscious from smoke inhalation. She'd been part of the QRF, first on scene, no time for hesitation, no time for protocol. Just muscle memory and the terrible clarity that comes when the alternative is watching someone die. Her hands moved on their own now as she gathered the decompression kit. 14-gauge catheter. Antiseptic. The fingers that pulled these items from the cart had held pressure on a bleeding child's shoulder while calling for evac. Those same fingers had taught themselves to write medication orders instead of casualty reports, to move through hospital corridors instead of through hostile territory. The muscle memory never left. It was patient. It was waiting. She turned back to Wade's bed, and something in her posture shifted so completely that even Sterling stepped back. This wasn't the quiet night shift nurse who accepted his humiliation in silence. This was someone else. Someone whose hands were steady as a hydraulic press. Someone whose voice had the weight of a transmission from command. "I need the second intercostal space, midclavicular line," she said to no one in particular. To everyone at once. "Get me the kit. Now." A resident fumbled forward with the needle. Natalie didn't take it. She locked eyes with him for a single second that felt like a full tactical assessment. "No. I'm doing this. Step back." It wasn't a request. It was a command. She moved Wade's gown aside with the efficiency of someone who'd undressed wounded soldiers in the dark. The anatomy was the same whether it was a general or a private, ribs, intercostal space, the thin membrane between life and the void. She marked the spot with her thumb, her touch so clinical it could have been a measurement tool. The antiseptic wipe took 3 seconds. The needle took 1. The hiss of air escaping from Wade's chest cavity was the sound of pressure releasing. The sound of gravity reasserting itself. The sound of a man getting his next breath back. The monitor shifted. Oxygen saturation climbed. 51. 58. 64. Her left hand stabilized Wade's chest while her right hand taped the catheter in place with movements that suggested she'd done this hundreds of times, which she had, though not in any hospital. 70. 76. 82. Wade's breathing deepened. His neck veins deflated. The panic drained from his face, replaced by the appearance of a man who'd just been pulled back from a cliff he hadn't known he was standing on. 88. 92. Stable. "Get a chest tube set up," she said, her voice still carrying that weight. "We need to confirm the lung reinflation with imaging. Now." Nurses scattered to obey, and Natalie realized what she'd done in the moment the realization showed on their faces. She'd given orders like a commanding officer. She'd used terminology like reinflation instead of the lung coming back. She'd moved with the precision of someone trained for trauma responses that existed outside the civilian healthcare system. Her hands had revealed things her file said were impossible. Sterling stood frozen at the far side of the bed, his authority evaporating like sweat under a desert sun. He'd watched a junior nurse perform a procedure at the level of an attending physician. He'd heard her assess a diagnosis he'd missed by 50 seconds. He'd seen her take command of his hospital room and watched his nurses obey her without question. For 6 seconds nobody moved. Nobody spoke. The ventilator wheezed. The monitor beeped its steady, grateful rhythm. Then Sterling's phone buzzed in his pocket. He pulled it out, glanced at the message, and something flickered across his face, not fear, not yet, but the early recognition that he'd made an error. Not a medical error. An institutional one. He'd tried to destroy someone without understanding who they were, and the evidence of that someone's true nature was now impossible to unsee. 3 nurses had witnessed a needle decompression performed with military precision. A resident had seen command structure reassert itself. General Wade was lying in a bed breathing air that should have remained locked in his chest cavity, alive because a woman Sterling had been actively trying to fire had recognized what he'd missed. Natalie wrapped another piece of tape around the catheter site, her movements economical and complete. She didn't look at Sterling. She didn't acknowledge the shift in the room's entire electromagnetic field. She simply existed in the space she'd claimed, and everyone around her had recognized that she'd earned it through a demonstration of competence that transcended any credential hanging on a wall. "Oxygen saturation stable at 94, she said to the resident. "Get him to imaging. Full chest series. Call thoracic surgery, they'll want to see this before we decide on tube placement." The resident nodded and moved, and Natalie stepped back from the bed as if she'd never stepped forward. As if she was once again the nurse from the night shift. As if the last 90 seconds hadn't just revealed that she was something far more dangerous than a woman with a grudge against hospital protocol. Dr. Sterling's office door clicked shut at 2:02 p.m. He didn't sit. He stood at the window overlooking the ambulance bay, his hand already reaching for the phone before his secretary could ask what he needed. His fingers moved with the precision of a man activating a network he'd spent 15 years constructing, a network built on favors, on the unspoken debts of people who understood that institutional loyalty ran deeper than integrity. The first call went to Richard Bancroft, the board chairman. Sterling's voice remained level, almost conversational, as if discussing whether rather than orchestrating the demolition of a night shift nurse who dared to question his authority in front of a patient's family. "Richard, we have a credentialing issue. A security concern. Night shift RN by the name of Natalie Hayes. Her employment history has substantial gaps. Unexplained absences spanning multiple years. I'm not comfortable with her access to critical patients until we've done a full background review." He paused, letting the implication settle. "I'm thinking we bring in an external investigator. Someone thorough." The second call went to Administrator James Whitmore, who'd approved Sterling's expansion of the ICU 3 years ago, an expansion that had come with Sterling's recommendation that the hospital purchase equipment from a company in which Whitmore held a consulting contract. "James, I need a favor," Sterling said, his tone suggesting this was a small thing, barely worth mentioning. "I'm referring a credentialing audit. Routine matter, but sensitive. I'd like it handled discreetly. Quietly. Before word gets out that we've had a potential fraud on staff." Another pause. "I can email you her personnel file within the hour." By 3:15 p.m., Sterling had made 7 calls. Each one was surgical in its precision. Each one planted a seed of doubt without ever explicitly saying what he wanted. The network understood. The network always understood. The investigator arrived by 4:53 p.m., a lean man named Holloway with grey threading through his beard and the bearing of someone who'd spent time in federal service before pivoting to private consulting. Sterling briefed him in a conference room with the door closed, spreading Natalie's personnel file across the polished oak table like a prosecutor laying out evidence. "Here," Sterling pointed to the employment history. 2003 to 2008. 5 years. No explanations. Then 2011 to 2014. Another gap. 3 years unaccounted for. Then 2015 to 2018. 2 more years missing. He let Holloway absorb the pattern. "In my 23 years running this department, I've never seen a nursing credential with this many holes. It concerns me. It should concern the board." What Sterling didn't say was that he'd already decided what the investigation would find. What he didn't say was that the gaps in her record were precisely the kind of holes that couldn't be explained without invoking classification levels that no civilian hospital credential office had clearance to access. What he didn't say was that he was counting on Natalie's inability to defend herself, because defending herself would mean revealing things that couldn't be revealed. By 6:06 p.m., Holloway had submitted his preliminary findings to Whitmore. Fraudulent credentials. Gaps indicating false employment history. Potential security risk. Recommendation: immediate removal pending full federal background investigation. By 6:44 p.m., security was walking Natalie Hayes out of Sacred Heart Hospital. She didn't protest. She didn't ask questions. She simply stood as the security guard explained that her credentials were under investigation and she was to leave the premises immediately pending review. Her face remained level, her breathing controlled, her eyes fixed on a point somewhere beyond the guard's shoulder. One of the nurses, Maria, who'd worked beside Natalie for 4 years, started to say something, then stopped. Orders had come down from administration. Don't speak to her. Don't acknowledge her. She was radioactive. Natalie cleared her locker in 8 minutes. The cracked mug from the 2004 Naval Hospital Camp Lejeune Medical Conference. The succulent she'd kept alive on the windowsill for 2 years, its leaves pale and dried from the fluorescent lights. And the photograph, creased and faded from age, the color shifted toward sepia, showing her SEAL team at Camp Taji in 2003. 12 faces. 4 of them gone now. All of them officially erased from existence along with Operation Phantom Shade, the mission that had been scrubbed so thoroughly from the historical record that not even its name could appear on any official document. She placed each item in a cardboard box that the guard provided, moving with the deliberation of someone packing away a life that had never been permitted to exist. The badge came off last. She set it on top of the mug and closed the box. The rain started before she reached the bus stop. Not a gentle rain. The kind that hammered against the pavement like it had a grudge against the city, soaking through her scrubs in minutes, turning her hair dark and heavy. She sat on the bench, the cardboard box balanced on her lap, and watched the rain stream across her shoes. Her phone buzzed. 3 messages from numbers she'd never responded to. A missed call from her ex-husband's lawyer. An email notification from the hospital marked final paycheck processed. The box felt heavier than it should have. She looked at the photograph through the cardboard. She could see the outline of it, the shapes of faces that belonged to a woman who no longer existed officially. 20 years. She'd been underground for 20 years, living in the margins of civilian life, performing the role of a quiet nurse who kept her head down and asked no questions. 20 years since the Pentagon had called her into a classified briefing and told her that Operation Phantom Shade had never happened. That her security clearance was being revoked. That her service record was being sealed. That she needed to disappear into a life that would never ask where she'd been or what she'd done. They'd given her a name, Natalie Hayes, and told her to use it. Natalie Hayes could be a nurse. Natalie Hayes could work night shift. Natalie Hayes could fade into the background of American hospitals where nobody asked questions about gaps in her history. Nobody scrutinized the spaces between employment dates. Nobody thought about the woman in scrubs who moved through trauma bays with the kind of practice certainty that came from holding lives together in hums and fobs and desert-safe houses where the rules of international law didn't apply. She opened the box. The mug stared up at her, chipped on one side, the Naval Hospital logo faded. She'd bought it 20 years ago as a souvenir from a deployment that had been expunged from the record. The succulent was already dying, its roots probably rotted from water pooling at the bottom of the pot during her shift that morning. The photograph was the most dangerous thing she owned. If anyone at the hospital had looked closely enough to see those faces, to recognize the insignia on the uniforms, to understand what unit patch had been sewn into her jacket lining. She held the photograph up to the rain. The image blurred. The faces dissolved into watercolor abstractions. She could tear it. Let the rain dissolve 20 years into pulp and forgetting. She could throw the mug in the trash. She could leave the succulent on the bench for someone else to wonder about. She could walk away from the cardboard box entirely and become someone new again. Someone with a different name. Someone who'd never been a SEAL. Someone who'd never held a dying child in the back of a Humvee in Tikrit while her hands worked to stop the bleeding and her voice stayed calm and her mind calculated survival probabilities with the cold mathematics of someone who'd been trained by the United States Navy to do exactly that. The rain hammered against her shoulders. She looked at the photograph. Recognized the face of the 6-year-old boy she'd pulled from the wreckage that day in 2003. His eyes were bright with trust, not understanding that the woman kneeling beside him in a borrowed civilian dress had just violated a dozen protocols to extract him from the burning vehicle. Not understanding that she'd done it not as Senior Chief Petty Officer Natalie Hayes, a designation that didn't officially exist, but as someone with nothing left to lose and a child who needed saving. She placed the photograph back in the box and closed it. And that's when she heard it. The sound started low and distant, a rhythm that didn't belong to the rain or the city traffic. A thumping that grew louder, more insistent. She looked up through the downpour and saw it, black against the grey sky, moving with purpose, the rotor wash beginning to push the rain sideways. A Black Hawk helicopter descended toward the hospital parking lot 2 blocks away, its rotors cutting the rain into horizontal sheets. Then another. Then a third. Natalie stood, the cardboard box still balanced against her hip, and watched the helicopters settle onto the pavement with the coordinated precision of a military insertion. Men in digital camouflage began exiting before the rotors had fully slowed, moving with the fluid efficiency of operators who understood that every second of exposure was a liability. They were looking for someone. She had no idea it was her. The FBI agent stepped forward, his badge catching the fluorescent light as he positioned himself between Sterling and the conference room doors. His voice carried the weight of federal authority, not loud, but absolute. Dr. Sterling attempted to forge Senior Chief Petty Officer Hayes' service records. The document alterations were detected during routine background verification. This constitutes federal fraud. Sterling's face drained to the color of old parchment. His mouth opened. Closed. Opened again. "We've been investigating since this morning," the agent continued, pulling a sealed envelope from his jacket. "The forgeries are documented. The intent is clear. You were attempting to justify her termination by fabricating evidence of fraudulent credentials. I was protecting the hospital from. You were committing a federal crime." The agent's hand moved to his belt. 2 more agents appeared in the doorway. Their boots on the tile sounded like a countdown. "Dr. Pierce Sterling, you're under arrest for document falsification, obstruction of justice, and conspiracy to commit fraud." Sterling lunged for the door. One of the agents sidestepped with the casual precision of someone who'd done this 1,000 times. The handcuffs came out, silver and efficient. They clicked around Sterling's wrists with a sound like a final diagnosis. "You don't understand," Sterling gasped, his voice climbing into territory that no chief of surgery should ever occupy. "She lied about her background. She's a fraud. She doesn't belong here. She's dangerous. I was protecting." The agents walked him past the conference room. His protests echoed down the corridor, raw, frantic, the sound of a man watching his entire architecture collapse in real time. Nurses stopped in the hallway and watched him pass. Nobody looked away. Nobody interfered. The silence that followed his screaming was louder than the screaming itself. General Marcus Wade stood from his hospital bed. The fall line caught for a moment before one of the hospital staff gently freed it. His legs shook, not from weakness, but from the tremor that comes when a door opens on 20 years of buried memory. Tears began before he reached the file that sat on the bedside table. His hands moved across the pages like a man reading his own resurrection. Navy Cross. His eyes stopped there. The medal that sits at the apex of naval bravery. He looked up at Natalie, who stood at the edge of the room in her scrubs, still wearing the fabric of her hidden life. "This is real," he whispered. "Not a question." "It's real," she said. He turned the page. Silver star. Then another silver star. The decorations of a warrior. His voice cracked across the words, "Tikrit. You pulled me out. You were there. You saved." He couldn't finish. A voice came through the speaker on the tablet positioned on the conference table. Older, weathered, carrying the texture of command. Commander James Holloway, SEAL Team 3, retired but still bearing the weight of every operation he'd overseen. "Senior Chief Petty Officer Natalie Hayes," he said, and each word carried the formality of a salute delivered in sound. "Bronze Star for Valor during Operation Prophet's Gate, 2009. First Silver Star for Exceptional Leadership Under Fire, Helm and Province, 2011. Second Silver Star for Actions Beyond the Call of Duty, Jolan District, Fallujah, 2013. He paused. The silence filled with everything unspoken. Navy Cross. For Extraordinary Heroism in Combat Operations, 2015. Operation Phantom Shade. Classified then. Classified now. But Senior Chief, you know what happened. Your nation knows what you did. Natalie's jaw moved once. That was all. Just once. But the muscles under her skin shifted, the kind of movement that happens when someone is holding something back that weighs the approximate tonnage of a decade and a half of silence. You were ordered to disappear, Holloway continued. The operation was erased. Your records were buried. You were instructed to assume a civilian identity and maintain that cover indefinitely. Those orders are now rescinded. The room seemed to contract around those words. Rescinded. After 20 years of living in the margin, of being a ghost in a hospital, of watching people like Dr. Sterling treat her as less than, those 3 syllables became a doorway opening. General Wade moved with careful deliberation, the movements of a man still healing but driven by something that transcended physical limitation. He stepped toward Natalie, and she didn't move. Didn't flinch. Didn't breathe visibly, though her chest rose and fell under her scrubs. He lowered himself onto one knee. The foot in his other arm bent at an angle that would have caused any standard patient pain, but he ignored it. His hands trembled, not from weakness but from the acknowledgement of what she had cost to save his life, not once but twice. Once as a child in a burning Humvee in the desert. Once in the chaos of Sacred Heart Hospital 3 days ago. Senior Chief, he said, and the title was a benediction. The promotion ceremony happened in the chapel. Natalie stood in dress blues that fit her shoulders like they'd been waiting 20 years for her to claim them again. General Wade held the insignia, the rank she'd earned in blood and fire and the kind of decisions that exist in the space between duty and survival. His hands were steady now as he pinned the new rank to her collar. Senior Chief Petty Officer, promoted. The rank that had been frozen, suspended in the liminal space between classified operations and the official record of her death on paper. The rank that made her what she'd always been but was finally permitted to be. "Welcome home," Wade whispered. 6 months later, someone spotted Dr. Sterling at a folding table outside a strip mall urgent care center in Tucson. He was selling insurance policies, the kind that nobody wanted, the kind that took 15 minutes to explain and ended with the customer declining and leaving. His name tag read, Steve. When a patient said "Thank you, Dr. Sterling," he flinched like the title was a physical thing, sharp enough to draw blood. The weight of it pressed him down into his chair, and he hunched lower, making himself smaller, becoming the kind of person that institutions like Sacred Heart never noticed at all. Natalie returned to Sacred Heart, but not to the night shift. The hospital board announced reforms, a new trauma protocols division, mandatory cultural competency training, a veteran-focused care wing funded by federal grant and General Wade's personal contribution of $4.7 million. A position opened, Director of Combat Trauma Medicine. The board offered it to her. She declined. Politely. With the same quiet dignity that had carried her through 20 years of invisibility. Instead, she worked the trauma bays in dress blues, because the uniform mattered now, but so did the work. She checked vitals on the broken and held the hands of the terrified, and when young nurses asked her why she didn't take the office job, she told them, "My fight is here. In the dark. With the people nobody else knows how to save." The trembling wasn't fear. It was restraint. The choice she made every single day to use her hands for healing instead of the 100 other things those hands had been trained to do. Scars tell stories. Some of them take 20 years to read aloud. General Wade visited on a Tuesday, and when he saw her standing over a trauma patient, her hands moving with the precision of a surgeon and the decisiveness of a warrior, he understood why she'd said no to the promotion. She was already home. She'd never actually left. Hit like and subscribe if you're enjoying this. And I'm always curious, drop a comment and tell us if you're watching from a big city or a small town. Now let's continue the story.